Welcome to the Realize Podcast, brought to you by Dr. Jacob Wilson and Dr. Jacobi Cleaver, optometrists combining their love for eye care and movies. We pick a movie, watch it, and review it while incorporating elements of optometry as it relates to clinical cases we've encountered in practice, current trends, and recent developments across the optometric industry. Seen any good movies lately? We have.
So sit back, grab a bucket of popcorn and your glasses, and let's have some fun.
As promised, we are back with another episode. I'm one of the co-hosts, Dr. Jacobi Cleaver, joined here by the other co-host, Dr. Jacob Wilson. And for those who are watching us on YouTube, you may notice a third person joining us this evening, our friend and colleague, Dr. Josh Reese. He made the recommendation that we should watch this movie, and in our non-discriminatory form, we went and checked it out, and it was a pleasant surprise, I must say, and we'll get in that and get into that.
Yeah, it was great.
Yeah, it was pretty good. It was pretty good. But Dr. Josh, Dr. Reese, please introduce yourself. Let the people know who you are, where you're coming from, and what you're doing.
Yeah, my name's, I guess, Dr. Josh Reese now. I just graduated from the Arizona College of Optometry. And I'm here in Portland, Oregon, doing a residency in vision rehab, pediatrics, and neuro optometry. So it's been kind of a steep learning curve, but it's been good. And I did give the recommendation to watch Freakier Friday.
Yeah, it was a good recommendation, man.
Yeah. He's giving you a hard time. We like
that. You know what, Josh? I was for whatever reason, man. I was thinking you was doing a residency on the East Coast somewhere, and I'm not sure why that stuck with me up until when we was texting about trying to get a time and stuff set up. So, how are you liking Portland?
It's been good. I did apply to a lot of East Coast residencies. I kind of applied to a ton of them. But yeah, I did end up on the West Coast. I'm loving it. It's a little colder than Arizona. Even in the summer, I have to turn the fireplace on and stuff. But it's been good.
It raining a lot?
It has rained a lot recently. Yeah. Although it's back sunny again. So it's up and down. Cool. Also, I wanted to say I've only ever listened to the podcast on Spotify, so that intro was amazing. Really good effects.
We tried. Yeah, we're looking. Dr. Wilson and I are gonna be. Are you going to Academy, Dr. Reese?
I don't think I will be.
Okay.
No, are you both going to be there?
Yeah, we'll both be there, and it'll be the first time since we launched the pod that we'll be together. So our social media manager is going to be there. She's going to take some good pictures and footage of us and stuff. So we probably won't stick with that intro for very long. We'll probably have another one by the time we come back in October.
An updated
but kudos, man. Thanks, man. Appreciate that. Appreciate the deal. But before we get started, man, we always like to start out each episode off with a cool clinical case, or maybe over the last week, or maybe, Josh, maybe just since you started your residency. So anything cool that you would like to share that you don't mind breaking down for the audience?
Well, top of mind, I had a patient today who we're starting vision therapy on. They're a V-pattern exo. Small kid, but it was just very interesting. It's one of the first times I've seen a true, you learn about them in school where you're they're more ESO and inferior gaze and more exo and superior gaze, but it's really true. Just watching his eyes, it's like, whoa.
Right.
And so now we're starting some vision therapy, and I've been working with the therapist on how to treat them differently. It's still they're young enough where it's a lot of motor and just basic play and development for the first couple of sessions. But it's been good. It's been an interesting case.
So for the audience listening, how would you, in layman's terms, you describe exotropia and esotropia?
Yeah, and that
in the V-pattern exotropia.
Oh yeah, that's true. So exotropia, any kind of tropia, what we mean is a term for strabismus, which is a fancy word for eye turn. Mm-hmm. So a lot of colloquial people call it a lazy eye. There's a couple of different types of lazy eye when you're an eye doctor, but strabismus is eye turn. Exotropia mean the eyes like to turn out towards the ear. Mm-hmm. So this guy, it's kind of intermittent, meaning that it's not one eye or the other. It's not one eye all the time. It's kind of either or. And V pattern is like a V, where when he's looking up, his eyes are more exotropic than when he's looking down. It's kind of ortho, actually, an inferior gaze.
What's that mean? What's ortho mean?
Well, ortho means both eyes are pointed straight ahead.
Ortho means normal positioning. So
Normal
for those listening to the podcast on Spotify or Apple Podcasts, pause it and then go look at the video on YouTube, and then Dr. Reese is giving us a fantastic demonstration of exo V pattern and everything with his hands here. So this is a real treat. So pause it if you're listening to the pod on Apple Podcasts or Spotify, and then go check us out on YouTube to get Dr. Reese's fantabulous demonstration here.
Yeah, Josh, that was great. I love the way
explain vision therapy if you don't mind.
Okay.
Oh.
Yeah.
Oh, the kind of the layman's term that I use is it's like physical therapy, but for the eyes. So if you like broke an ankle and you need to get back into using your ankle again, you go for a session. They give you some activities that they do with you. They send you home with some activities, and over time you build up strength in your ankle. It's the same kind of thing, but for the eyes. So let's say this exotrope learning how to use his eyes together. You get some different activities, let's say, to be able to use your peripheral vision better, and then be able to know where your eyes are pointing and eventually point them together and improve your eye coordination. So that's what I like to do for vision therapy.
So is that the explanation you would give to a parent if you was making the recommendation for vision therapy?
That's mostly because I talk to kids a lot. That's mostly how I explain it to kids. Parents, depending on how involved the parent is and how many questions they have, you'd go more into some of the science and the studies. And but yeah, generally that's my spiel.
That's a pretty good spiel, man. I don't do a lot of vision therapy in my practice. Well, I don't do any, but I'll use that spiel if I need to. That from now on, so I appreciate that. So, what about you, Dr. Wilson? Any good cases over the last week or so?
Yeah, well, first, just props to Josh on that explanation. I can imagine sitting there with my kid and having you explaining that. I'd love to have you. Did a great job explaining that.
Hey, hang on, Jacob. We're having some issues with your audio.
Yeah, audio.
Yeah, just a little bit. Yeah, it's kind of staticky.
I think it's better now. No,
not at all. No, we can't hear you at all.
How's that?
Much better. Okay, so we'll just pick up here. I can edit that out of there. So
yeah, we'll edit it out. I just wanted to say, first of all, props to Josh on that explanation. I would love to have you be like my kid's pediatric doctor. You had us engaged, and that was great. I noticed you said it's been kind of a bit of a learning curve in residency, right?
Yeah.
Definitely, my friend. We'll keep with it. Maybe do you have any words of advice to give to fourth years who are applying for residency right now?
I mean, they say it's like another year of school, but like on steroids, because you learn so much. And it really is like for specifically vision rehab or pediatrics, there's so much in school that you touch on, but you don't know like the back of your hand. And residency is like trial by fire. Like if you don't know it like the back of your hand, you're gonna get steamrolled, by all these people with all these questions and all of these complex cases that you're seeing all day, every day. And so you really like internalize your field of optometry that you go into. So it's been really, really cool. I don't think I would have been able to, get this amount of learning so quickly if I had not done a residency. I just was, I thought I was ready to take a break after school ended, but
nope.
No, life keeps going forward.
Nice.
Yeah. So for everyone listening who maybe doesn't know, residencies are postdoctoral training, or it's a year of training that you do after optometry school. and it's optional for optometrists. So we don't have to do residency. Many of us choose to, but you don't have to. And so like Josh was saying, someone might choose to do that just to get more training or get more specialized in a certain area. So that's what Josh is doing. I commend him for that. I know it's not an easy year, but it's a year that's worth it. Yeah. Definitely. Any fourth years listening, I'm a big proponent of residency. I know Dr. Cleaver is. I know Dr. Reese is too. But it's a personalized decision. We'd love to chat with any of you anytime if you have questions about it. As far as cases go, from this past week, I haven't had anything too crazy. I had an angle recession, which an angle is the part of the eye where basically it's where the colored part of your eye meets the clear part of your eye. And that's where all the fluid inside of your eye continuously drains out of. It helps regulate the pressure inside of your eye. And if you get that angle damaged or recessed, which can happen from trauma, this person had gotten a fight, was the best I could figure out. It can mess up that drainage system, and it can cause the eye pressure to become high inside of your eye. And it can give you what we call glaucoma. And glaucoma is damage to the back of the eye from high eye pressure. So he didn't have glaucoma yet, but it just happened. So we'll keep watching him, and we'll see what happens with this damage to his angle.
So pressure is pretty important in glaucoma, Jacob. Can you recall what his pressure was?
Yeah, I think it was like 26 or 27, and we generally want to be below 22. So, there's no damage to the back of the eye yet, so we're not officially calling it glaucoma, but that's probably the direction we're headed, to be honest.
So did you start him on treatment?
Oh, go ahead.
Did you start him on treatment?
Yeah, we got his pressures down. We got him on latanoprost. So I think we had him on latanoprost and Cosoft, if I remember right. And so we'll see him back this week for an IOP check. But and hopefully we can keep it down. And if we need to, we'll refer to a glaucoma specialist. Because I've had cases like this where we really can't control the pressures with just drops. So we might have to send him out, but we'll see what happens.
Mm-hmm. So the moral of this story is, if you're going to get out in any fist fights, then you need to learn how to block. You can't keep taking those blows directly to the eye, man. You give yourself glaucoma or something. We don't want that to happen.
I got to tell you, man, as a kid, and not that I was like some hoodlum running around, but I'd be like, all right, if you're going to mess with me, we're going to fight. That was just in my mind. That's how it was as a kid. And you see it in the movies all the time. People get in fights and they never get hurt from fights. You only get hurt when people pull out guns. I got to tell you, as a doctor, people get hurt from fights, just regular fist fights all the time.
Right.
Life-changing injuries all the time. And I'm glad I wish that's what's something I want all young people to know is don't be out there getting in fights for no reason. It's never worth it. So
yeah,
true that. I had a case yesterday, and it was really about one patient that kind of segued into another patient. So I had a patient that was on long-term management for what was termed chronic dry eye. So she was using over-the-counter lubrication drops, a lubrication ointment. She's taking omega-3s, and she's doing Restasis. And and she came in and said it's just, and she was 35 years old, and she said she's been under this treatment for about 6 years, I want to say, and it's just not getting any better. So I started asking her about what's been tried, what hadn't been tried. Have they made any mentions about any type of punctal plugs or anything like that? And she said no. And so I started asking her, well, are you getting any pain in your joints or anything like that? Because with that amount of, and that is a lot of drops to take, right? So I would assume, or I would be looking for the front surface of the eyes to look a lot better than they did yesterday. If she's taking all that, which I definitely believe that she was taking it because she was well with it, right? So I started asking her about joint pain and stuff like that, and nothing real specific. She said she did have some a little pain in her foot, but she just kind of chalked that up to something else. And then I asked her if she has any trouble swallowing, or does she feel like she needs to consume a lot of water whenever she's drinking water or thirsty. And she said, yeah, I do. So I work in a multidisciplinary clinic. I walked down and hollered at the rheumatologist, and she was like, yeah, it may be Sjogren's. So she gave me a bunch of labs to order, and the rheumatologist ended up seeing her the same day. So we're just
amazing.
we're just waiting on the results of the lab to see what's up with that. Oh, and on top of that, she was taking prednisone steroid drops on an as needed basis too, and the front surface still looked just wrecked. So,
and I don't like that either. I don't like the steroid going on there.
I don't either. Like, and, it's just so much that just can go wrong with that. Now the likelihood of someone developing increased eye pressure from PRN steroid use is probably not very high, but it just takes that one time for you for it to creep up, right? But anywho, so I'll follow up with her in a couple of weeks, and I'll have some results for that with the rheumatologist. Come home, and we communicate through Epic. I'm not sure what you guys use at work, but we use Epic EMR, and it has this instant messaging feature on there. So I get home, and the rheumatologist sends me a message on there. She's like, "Hey, you know what? I had a patient today that I've been seeing for Sjogren's, a totally different patient. I've been seeing for Sjogren's. She's been complaining about headaches, and on a totally incidental finding from a CT, the patient had an ophthalmic artery unruptured aneurysm." And she said, exactly. And she said, "Well,
good catch."
Yeah." And she said, "Well, what should I do next?" I put in a referral to neuro. What should I do next? What else should I order? I said, "Well, you can consider a CTA or MRA at this point." But I said, "Doc, how quick can you get them in to see neuro? If it's unruptured, it could literally rupture at any point, right?" And she said, "Well, I hadn't talked to anyone. I just put in a referral. I hadn't heard back." I said, "Well, if it was me and the patient was sitting in my chair, I have her go to the emergency room." Yeah, exactly. With a note,
probably walking
and detailing my findings, what happened, and let them take over and do what needs to be done there. But I just did a quick research on that yesterday. Like 1 to 2% of aneurysms occur at the ophthalmic artery, so it's extremely rare. It's just a totally incidental finding, man.
Wow.
So yeah, I was, here I go thinking yesterday was just going to be a boring Tuesday, but yeah, I get that in there. It was pretty magnificent to see. So hopefully we'll get some good news with her. I'm not sure what the treatment would be if it's dealing with the ophthalmic artery. I know typically they'll do clipping with aneurysms or something like that, but we'll have to wait and see and let neurosurgery do their thing with that. But I'll definitely have an update in the future.
I'd be really interested to hear, what they do with that. And I wonder if, I'd be interested to hear what they do with that and who exactly does that surgery and all of that.
I imagine it'll have to be a team.
Yeah.
Team, anesthesia and
neuro-ophthalmology.
I figured it had to be a collection of folks doing that because.
Wow, that's intense.
Yeah.
That's intense. That's a great. I've never even seen or heard of one of those except for in school. So that's
yesterday was my first day too.
Yeah.
and I've been out of school a lot longer than you gentlemen have, man. So
way longer than we have.
Oh, there we go.
Yeah. And fun fact about school, Jacob and I were actually neighbors.
Yeah. I was going to tell everyone that. Yeah, I was telling Jacobi, I opened my door and your front door is right there where you and Diana live. And then Jenny and I live across the hall. So we do movie nights. We would dog sit for them, things like that. You were what? You were a second year. I was a fourth year.
Yeah, 2 years behind.
Okay. Yeah. Nice, sweet.
Was it, Jake? I wanted to touch back on the first story you brought up real quick, Jacobi, was about Sjogren's and what that is. Is it's an autoimmune disorder.
Yes.
So that's why you had sent over to the rheumatologist. And I was going to say that whenever I have chronic dry eye like that, just that isn't getting better, same thing. I always kind of start to suspect something rheumatology related going on. Dry eyes are a big deal in a lot of rheumatology related cases. And then what I was going to say, the reason I don't like the steroid getting put on that cornea sometimes is if a patient has rheumatoid arthritis, right, and they're at a greater risk for, why am I blanking on the name of it? Where the cornea thins and then perfs. We'll have to edit that part out. But
corneal ectasia?
No, do you know what I'm talking about, Jacobi? Where peripheral marginal PM
Oh yeah, no, you're right there. No, PUK, peripheral
PUK.
ulcerative keratitis.
Ulcerative keratitis.
Peripheral ulcerative keratitis, and the studies are pretty. I mean, they're kind of torn, but they show that steroids probably speed up the rate at which that cornea thins in PUK, and PUK is pretty highly associated with rheumatoid arthritis, or it can be. So theoretically, if you threw a steroid on someone with chronic dry eye and it actually was PUK or the beginnings of PUK, you could really cause a lot of problems. So I remember we had a case like that in residency, and so I'm pretty. If the cornea is not absolutely clear, this is my opinion. I usually won't touch a steroid if there's anything going on with the cornea. And the cornea is that front layer of the eye. That's just that one scared me because the eye did end up perfing and they had the cornea transplant and all that. And so
I mean, and even if you look back at the characteristics of who autoimmune conditions occur in, is usually more common in women than men. Almost 2 to 1, 3 to 1, depending on the specific condition. But she was right there at that age. And I mean, 35-year-old, female. I'll be surprised. And I know when you test for these autoimmune conditions, a lot of it is just kind of, you test for exclusion. So it may be a little bit of a drawn out process. But if there's something that can be done systemically, then we have to kind of look into that, whether it's methotrexate or whatever else. We have to kind of look into that, and maybe that'll provide some relief, and then get her off of some of those drops. I mean, because man, 3-4 drops, 3-4 times a day is a lot, and we all know that compliance just kind of tanks out the bottom of that. So I was almost assuming that she was continuing with everything because she was that miserable, like she was that uncomfortable, right? I mean, using gels, drops, steroids, blah blah blah. Like it's just a lot. It's just a lot.
It's a lot, yeah, and that reduces your quality of life for sure. So I mean, if we can help in a different way. But yeah, all right. Is that enough nerdy stuff? Should we get to the movie?
No, we just get started with the nerdy stuff, man. We got nerdy stuff all throughout this movie this evening, man.
Yeah,
but
that's really all I do is nerdy stuff. Yeah. Okay. All right. So we're doing Freakier Friday, not to be confused with Freaky Friday, which this movie is a sequel to, right? Not to be confused with Freaky Friday, which that Freaky Friday was a remake of, and not to be confused with the song by Chris Brown and Lil Dicky called Freaky Friday from 2016.
Oh, I forgot about that. I see what you did there. That's a nice play, man.
Yeah, and all kinds of stuff going. Have you seen that music video with Chris Brown?
No.
You should go look at it. If you haven't seen it, you should go look it up. They basically do the plot of Freaky Friday.
Oh, really?
Oh, really?
Chris Brown and Lil Dicky switch places, yeah. But anyway, we're doing
Freaky Friday originally based off of a book, right?
You know what? I didn't. My research, it was inconclusive. I'm not sure. I didn't go that far back, but yeah, Freakier Friday. Lindsay Lohan and Jamie Lee Curtis are back. Jamie Lee Curtis, I just wanted to do a little tribute to, just real quick, because I think she's one of the most important actresses of our time, actually. Jacobi, you might know this, but Josh, do you know what Jamie Lee Curtis's first ever movie was?
I really don't have any idea.
Do you know Jacobi?
Freaky Friday is my first guess, but
no, she was already older by then. 1978. You got it?
No, it wasn't. No, I don't want to look it up, man.
You don't? No. I got it all. Don't worry. It was. I got a document here. It was John Carpenter's Halloween, 1978. So, Josh, I don't know if you know this about Jamie Lee Curtis, but she's kind of the original Scream Queen.
Yeah.
So, really,
I'm a horror. I love horror, and she's the main protagonist in not only the first Halloween, but 7 of the Halloween movies in the franchise. There's about 10, I think there's 10 to 12 Halloween movies in total, and she's the main protagonist in 7 of them. She is meant to be Michael Myers, the murderer's sister and all this, and there's all this. But anyways, that was her first movie back in 1978. Halloween was a wildly successful movie, and that shot her into stardom. From there. Do you remember, Josh? This was kind of a funny story. I was thinking of your first experience with the Halloween franchise.
I do. That is. How could I forget?
I know. You want to tell us about it from your point of view?
So here I was at Academy in New Orleans. Right. And I had a roommate, the Dr. Jacob Wilson, and you fall asleep to horror movies, which I learned.
I sure do.
And so for a couple of nights, I had to fall asleep to some horror movies, and I'm not a horror movie guy. So it was quite the experience trying to get some sleep for that.
Yeah, I felt so bad after that trip because I was so oblivious. I was talking to Jenny. I was like, I think I might have traumatized Josh a little because we watched Halloween and Friday the 13th. And like one of the Friday the 13th movies was like really graphic. I thought it was on an edited channel and it wasn't. And I told my wife later, I was like, I hope Josh talks to me. I put the weirdest stuff on. But anyways, yeah, that's who I am. Yeah, Jamie Lee Curtis, I think one of the most important actresses of our time. Academy Award winner as of a few years ago for her role in Everything Everywhere All at Once. If you haven't seen that movie, it's great. Also won Best Actress, the Golden Globe for Best Actress for True Lies with Arnold Schwarzenegger.
Oh yeah, that was a classic.
In '92, which I didn't realize she won that for that. So those are great movies. She's been such an important pillar in the film industry. But anyways, Freaky Friday is the original Freaky Friday is one of her most famous movies, I would say, especially for my generation. And they did this, this is about 20 years later. So what happens in the first movie is Jamie Lee Curtis is Lindsay Lohan's mom, and they switch places during the movie. Right, and they can't switch back until they've learned a lesson from each other, all this, and they switch back, and that's the moral of the story. Well, now in Freakier Friday, we're about 21 years later, Lindsay Lohan is now a single mom, and Lindsay Lohan's name is in the movie is what's her name? Anna. Yeah, Anna. She's a single mother, and her daughter is Harper, and then she meets a man. And that man's daughter is Lily. And so they're kind of bringing this blended family together. And then Jamie Lee Curtis, she's still there as the grandma and the mom. But she's, I thought her in the movie, she's a therapist, Jamie Lee Curtis is. I thought this was kind of an unhealthy dynamic with how involved she was in everyone's business. But I was just thinking, I was like, a therapist, it doesn't seem like she's doing things quite right here. But anyways, Jamie Lee Curtis is always there with Lindsay Lohan and the girls. Basically, what happens is the girls hate each other, right? They don't want to get along. The girl and her dad, Lily, they're from London. Lily wants to move back to London. Harper wants to stay in LA. And they're kind of just going back and forth, and they don't like each other. What ends up happening is they kind of same thing in the first movie. They see this like not sorcerer, like I don't know, psychic, yeah. Sorcerer is like a Harry Potter thing. But yeah, and they end up switching places again. But this time it's a little different. And Jacobi, do you remember why it was a little different this time? It was more than just two of them switching.
Pop quiz.
Oh, Jacobi, we can't hear you.
Apologies. Yeah, they set the premise up there where what's the daughter's name on here?
Harper.
Okay,
yeah,
good.
Harper.
Okay, so they set it up to where Harper and Lily are science partners in science class, and they absolutely loathe each other, right? They do not like each other. They just kind of beefing and going back and forth. They're arguing in the science lab. They're mixing stuff. They're not paying attention, and it causes this big explosion. That prompts a parent-teacher meeting. Harper's
without
mom
eye
comes
protection,
up.
might I
Yeah,
add.
well, actually, yeah.
Yeah, that was a big
talk
part of
about
She
it.
that.
took her goggles off.
And then wouldn't put them on because of the lines, right?
Yeah.
Yep. And, man, I can't think of anything. Well, there's plenty of things worse than a chemical burn, but there's not many things worse than a chemical burn. So yeah, so
pretty bad.
those in lab or a chemistry lab or a science lab, you got to put that eyewear on, man. You got to protect those ocular surfaces and stuff. But anyways, that prompts a parent teacher meeting with not a teacher, a parent principal meeting. Harper's mom comes up, Lily dad's comes up, they meet each other, and from there they kind of fall in love. That's the gist of it. And from this point on, and I'll let Josh take over from this point on, but from this point on, they just kind of decide that they're gonna date and get engaged and all this other stuff. Josh, you got anything you like to add?
Yeah, I mean, the humor for all of this is pretty funny. It's really well paced, especially at the beginning to keep your attention. But eventually they have this bachelorette party before the wedding of the mom and the dad, or mom and I guess the family that's about to be blended.
Right.
Lindsay Lohan with the guy from The Good Place. I don't. What's
oh,
the
that is who
name?
that is.
Yeah,
that is who that is. I didn't realize that. Yeah. Okay.
But
Manny
loved his
Jacinto.
performance.
Yeah, his name's Eric in the movie.
Okay.
But Eric, the night of the bachelorette party, they're all not getting along. The kids aren't understanding the parents, and they were like, "Why are you trying to get us to stay in LA instead of moving back to London?" Or they all have their own gripes, and that's when they meet the psychic.
Yeah, that's correct. And the psychic was extremely funny, man, because it seems like Tess and Anna go and talk to the psychic first. And do you guys remember what the psychic kept repeating to him? The phrase she kept repeating to him? I wrote it down.
Yeah, not word for word, but yeah, what'd they say?
It said, change the hearts you know are wrong to reach the place where you belong. So they kept saying that over and over again. So they leave, and then the daughters come in, and they want to ask the psychic, we need you to tell us where we're going to move to or where we're going to live in the future. Can you handle that for us? And she was like, yeah. And the psychic's just kind of, Josh, what do you think about the psychic? She was just kind of shady, right? Like she had a bunch of business cards, and she's trying to have all these different side hustles and everything.
It was so funny. She's like, you can find me at the table at Starbucks.
Yeah. And
I also
put an apron on. Yeah.
But what other movie was she in? Because she plays the funny role in quite a few movies. I have to look it up here in a little bit, but she was really great at that. So she gets the daughters to sit down, and they're holding hands, and she's going through this and that and everything else, and she says the quotes to them again, and then at this point it's like the room kind of shakes, like it's an earthquake or something, right? And but there's no earthquake at all. The bachelorette party ends, they go home, and lo and behold, Jacob, they wake up, and everyone is somebody else when they wake up the next morning.
Yeah, and you got to keep up with it a little bit. So, and we'll kind of have to probably repeat it as we're going through. But yeah, so it's in the first movie, it's just Jamie Lee or Tess and Anna, Lindsay Lohan, that switch places. And this time, Lindsay Lohan switches places with her daughter, Harper. So Harper's in Lindsay Lohan's body. Lindsay Lohan or Anna is in Harper's body. And then Tess, Jamie Lee Curtis, switches places with Lily. So Lily is now in Jamie Lee Curtis's body, Tess's body, and vice versa. So that's everyone switched around. Older folks became younger folks. Younger folks became older folks. That's where we're at. That was pretty funny to imagine, like, what it would be like to go from being like 16 years old to being like 65 years old all of a sudden. Just like all the pain you would suddenly be feeling for no reason, like all the pain in your joints and things like that. And they laugh at that. They make fun of that a little bit throughout the movie. But anyways, they all switch places. Jamie Lee and Anna and Tess already kind of know what's going on because it's happened to them before, so they're trying to stay calm. And then Harper and Lily, who are in the older bodies, they're freaking out. Anyways, what ends up happening, Harper and Lily are the only people that heard what was said to them about changing the hearts that are wrong. So they're the only ones that know about it. Anna and Tess don't know about it. So Anna and Tess are like, we're going to figure out how to fix this. And then Lily and Harper are like, we already know how to fix it. We have to change the hearts that are wrong. And their interpretation of that is to get their parents to break up. They don't want their parents to end up marrying each other. And it's pretty messed up, but, it's probably a selfish teenager thing that, I think a lot of teenagers might do that in the situation. So they start coming up with all these funny plans to get them broken up. And I know Jacobi was talking about one of the funny ones he thought, but anything I missed there, kind of their transformation and kind of at the beginning of it there?
I mean, you missed that Jamie Lee Curtis plays a teenager way too well.
Yeah, she had to do some research. Like, she must have gone undercover, because she's like using all these phrases, and yeah, it was pretty great.
No, it was just the transformation was extremely funny because, like you said, Jacob, one of them woke up in a 65-year-old body. The other one woke up in a 16-year-old body. Like, oh man, nothing hurts. I'm like, I can bend over and pick up stuff. I don't have any pain. I can, my skin's not wrinkled and all this other stuff that's going on. But one of the funniest parts of the movie is when Eric comes in. Eric comes in with donuts, and Tess is just going crazy on the donuts. Tess, who is Lily at this point, right? So Lily's inside of Tess' body, and someone made mention that you need to slow down on the donuts. You're pre-diabetic. So this kind of brought us to at least brought me to my first optometry point. So what's the significance of being pre-diabetic? If one of you guys want to explain it, how does that relate to eye care and eye health?
What do you think, Josh?
Well, you want me to give the pediatric answer? So I say when your blood sugar's really high, your blood gets like syrupy, and it gets really hard to go through the blood vessels, and it can cause them to burst because we got really small blood vessels in the back of our eye. That's my explanation.
I can buy that. How would you explain it, Jacob?
Yeah, you treat this on a daily basis.
Well, you see the pericytes that surround the blood vessels, they start to break. No, it's Josh, I think you hit the nail on the head there. I think that's the easiest way to understand it is if your blood sugars are too high, it really can have some pretty significant damage to the vasculature of your body, specifically the smaller blood vessels in your body. Correct. And there's not many smaller blood vessels than the ones in the back of your eye. So actually, a lot of times in diabetic patients, especially if they're diabetic for a long time, or if their sugars are way out of whack, out of control, there's some other factors that might play into this too. But after a while, you start to see some breakdown of those blood vessels, and we actually see bleeding in the back of the eye. Where I work in a community where we have a lot of diabetes. Unfortunately, not a lot of access to. And we've talked about this before, not a lot of access to good food, not a lot of access to exercise or safe ways to exercise and things like that. And so you do see that from time to time. But it's a type of thing, diabetes. It's the type of thing, this is how it's always been explained to me. Genetics might load the gun, but we pull the trigger, with our lifestyle choices. So, I've had people who have diabetes for a long time and they take it seriously, get it under control, and we don't see any or maybe very little diabetic retinopathy or problems later on. But yeah, it's all, it can be pretty devastating when it's not controlled. Pre-diabetes, you would pretty much never see any type of bleeding though. So if you keep your sugars low enough where you never cross that line from pre-diabetes to diabetes, you should be okay. But pre-diabetes should be a wake-up call for sure.
Yeah, and not be eating those donuts.
Well, I mean, not eating them a dozen at a time like Tess was doing in the movies, but also for anyone listening, a fun fact about optometry: optometry is optometry and ophthalmology is the only professions where you can look at the blood vessels in live real time through a dilated eye exam, right? So, usually. If you are pre-diabetic, that means that your A1C is probably teetering pretty close to what's considered abnormal. Getting past borderline. So at that point, at least a lot of the primary care doctors that I know would would talk about lifestyle changes, exercise and diet, and those kind of things. Because, and I can't remember the exact percentage, but so many pounds, you lose so many pounds that decreases the blood sugar by so many points or whatever. I can't remember the exact ratio, but it does make a difference. But culturally, some of these things are hard to do. Like Jacob mentioned, if you don't have access all the time, it's hard to do. A lot of us live a pretty busy lifestyle, so going to the gym is probably not always feasible. Hell, I'm here in Texas, and they got a gym and a Whataburger right in the same damn parking lot. So so tell me how that works, right?
That sounds great.
Cancel each other out.
Yeah, exactly. Or actually, by the time you eat the burger and the fries and the drink, you're probably in calorie overload at that point. So whatever you did, you just negated your workout by quite a bit. So but we do have to take these things seriously. I just hate I don't want to discount anyone who's older, but specifically in younger patients, when there's like you start to have this loss of vision and everything else, like you just know that it's going to like just change everything in the patient's lifestyle at that point, right? Daily activities, whether you're working or whatever else, that's going to be hard to do, right? If you're running back and forth to eye appointments, name another condition outside of diabetes that has as many specialties as diabetes. In my clinic, the diabetic sees the primary care doctor, endocrinology at some point, podiatry. They're going to see us. If they need to go to ophthalmology, they'll go over there. They may see a clinical pharmacist at some point, a dentist at some point. So this lab work every 3 months. So it might be on dialysis. Yeah, that's a lot. That's a lot. All right, so now they switch partner bodies or whatever else, and now they're going out about everyone's regular business. So who wants to take over from here? Jacob, Josh, one of you guys?
One more thing on the pre-diabetes thing. I saw it with my parents, and my mom noticed something. The test was reaching into a flax seed and pulling out chocolate chips. Eating those.
Yeah.
And my mom does that same thing where she'll hide her chocolate chips to do a little snack and something healthy that looks healthy. So no wonder she has pre-diabetes, because she's hiding her sweets.
Yeah, you absolutely good point, Josh. Great point, because she does that quite often throughout the movie. She sure does.
It was funny.
I didn't even notice that. That's funny. Geez. Yeah, just we're not saying don't eat chocolate chips, but just in moderation.
That's true.
But if you've reached the point where you're having to hide it like that, I don't know. Yeah, we might need to get some psychological help.
Get some lifestyle changes.
But they've switched places. So one thing that's going on is Anna actually has a pretty cool job. So in the first movie, we learned that Anna's a musician, right? And in this movie, we don't get a ton of details on it right away, but it looks like she'd had a pretty successful career with a band. And then the band broke up, and now she's like a music agent / producer. And she's working with a young girl who's a famous singer. This young girl, actually, I really like the young woman that was playing the singer. I don't know if you guys ever watched the show Never Have I Ever.
Davey.
Yeah, she's Davey from Never Have I Ever. And she's great. So that's a good show to go watch if you have some time. But anyways, their first order of business at Harper as Anna is she has to go to work and pretend to be Anna, and she has no idea what she's doing. So that's a pretty funny scene. There's a kind of a breakup going up between the famous singer and her boyfriend, who's also a famous singer, and they're talking about like writing diss songs and doing all this. And they find out that Anna has a secret song on her computer that she wrote, what they think is written about her ex-boyfriend named Jake. So they kind of learn about this. And so now they have their plan on how they're going to break up Anna and Eric, is they're going to try and bring Jake, the ex-boyfriend, back into the picture.
And they think she still secretly loves him because they found that song about him.
Yeah, and then they went on Facebook and see that he's been liking all her pictures and all this stuff. So that's what they're going to try and do. So, and remember, they are in Harper and Lily are in Anna and Tessa's bodies at this point. So what they're going to do, they try to set up this meeting with Jake and it's kind of funny in the record store. But Jacobi, do you want to tell us about the record store? Is there anything we missed before that?
Because they're walking into the record store, and I can't remember exactly what was said, but they said something. She said, "Well, what does old people talk about, or what do old people wear, or something like that?" And they made the mention to about transition lenses, and I took offense to that, man. Every pair of glasses that I own has the transitions feature in there, and
for real?
Mine too.
For those listening, transition is the feature in lenses where when you're in direct sunlight, that changes the clear lenses to sunglasses. So you're almost getting the 2-for-1 in there. And and I think this is where I first met Josh a couple years ago. We were both at the Transitions Academy meeting, which they have every single year down in Orlando, which is a pretty fun meeting. People from all over the world attend, and if I'm not mistaken, it is by invite only. So it's not open to the public. I think there's certain criteria based on office and opticians and that kind of stuff. Like you have to be moving so much product or something like that. But I was invited there because I sit on the Transitions Optical Advancement Board. And I think I met Josh there a couple of years ago because he was a transition change agent as a student. And it's and Josh will tell you, it's a real fun meeting, man. I mean, they put you up in a nice hotel, and the food's real good, the entertainment's real lively, and the courses are pretty good. But the difference about Transitions Academy is that it's not really geared towards optometry or ophthalmology per se. It's more so based around the science of transitions technology. So at these conferences, they usually are introducing new products or the latest and greatest in transitions, whether it's colors or specific tints or whatever else. And it's a lot of fun. Josh, do you have anything you would add to that?
No, I mean, as a change agent, they really would just want you to wear the transitions and kind of help remove the stereotype that the movie reinforces that transitions are for old people. And so, yeah, I really liked, wearing those transitions and sporting them around. I now that I am in transitions, I think I'll have a hard time ever going out of them.
Yeah, that's how I feel about it too. But they have so many options now, Josh. And Josh is mentioning, well, Dr. Reese is mentioning, as when he was a student as a transitions change agent, him and some other students were selected to represent the brand. So they almost treated you guys like models, and they did a bunch of social media posts and photo shoots and everything else. And there's like commercials and stuff with these guys off in there. Like, it's just a fun time. And they asked me if I wanted to be a transition agent at one point. I said, nah, I think the younger generation are better suited for that, because you guys are a lot cooler than I am. But I know a bunch of our friends were doing it. It was you. I think actually Dr. Glover was the first change agent when they started many years ago. Dr. Glover.
Really?
Yeah. And her name escapes me. It'll come back to me in a little bit. But she's also in private practice. But she's served on a advisory board with me as well.
Mm-hmm.
But no, it's a fun meeting. So if you guys ever have if anyone listening ever has a chance to go to the Transition Academy meeting in Orlando, it's usually in February. It's a real good time, man. You'll enjoy it quite a bit.
Yeah, I'll have to get there. I just ordered a pair of transitions yesterday after talking with Toby a little bit. So at a practice I fill in at sometimes, I ordered a pair, and they did have some pretty cool options. I got like a gold mirror transition.
I got a pair of those. Those are so money too, man. They look so good.
I got this nice Burberry frame. I'm gonna be looking good. You guys will see it.
Yeah, fresh to death.
We'll have to see.
So they go inside the record store. And I'm trying to keep it straight. So Anna, who is Harper, is trying to flirt with the ex-boyfriend, and she's doing a horrible job at it. And she's doing such a horrible job at it that the ex-boyfriend, I can't remember, I want to say his name was Ryan. The ex-boyfriend is like, man, you may be having a stroke, which brings us to our next optometry moment here.
Okay.
Why are we concerned about the possibility of a stroke as it relates to eye care or ocular health?
I think you touched on something pretty interesting at the beginning of the episode with your patient that had the aneurysm, right? I mean, Yeah, I mean, any catastrophic bleeding or, an ischemic event like that can have significant damage to the body or the brain in general. But to the eye, I mean, you could lose vision completely to the eye. You can have what's essentially a stroke in the eye and having a vein or artery occlusion, right? And people, it's painless vision loss that can happen. So that's one thing that comes to mind.
Yeah, and then usually with I believe the leading cause of stroke is mostly due to high blood pressure.
Yeah.
So which is termed a silent killer. So sometimes as your blood pressure is through the roof, you may get a headache or some other associated symptom. But you hate to get to the point to where you have a stroke, and which can have debilitating effects on the vision, but also the body as a whole as well. So this is another public service announcement of why frequent visits to the primary care doctor are important. Getting your cholesterol checked, getting your blood pressure checked, start medication if need be, or if you can't get it right with the diet and exercise. But this is I prefer to do maintenance care as opposed to having to explain to the patient, unfortunately, the vision's probably not going to come back. Which is a tough conversation. Not that I enjoy giving bad news, but it's part of the job as a medical provider that sometimes you have to give the bad news.
I want to. Oh, go ahead, Josh. Go ahead.
Oh, I was just going to say, in the vision rehab space, we work a lot with patients with vision loss due to strokes, especially. So stroke is anytime, oxygen gets cut off to the brain or the areas around the brain. And so a lot of times when that happens in the back where the occipital lobe, you can lose half your vision. Just right. Half of it's gone. Painless vision loss. And so helping patients who have had strokes with this kind of vision loss is actually, I don't know. I have a patient that I'm helping right now who it's just so sad. Anytime she sees me, she just says, "I wish I had your eyes again. I wish I had your eyes again." And it is, I don't know, it makes me cry a little bit every time. So yes, we also catch strokes sometimes. Not the other day, someone came in and confrontations was, didn't see this, saw this, didn't see this, saw this. And I was like, oh no. And he did end up, we will send him to the emergency room. He did have a stroke. So
yeah. And to catch a defect through confrontation fields is pretty impressive too, because that means that there's significant loss. It's not like we're testing anything on a very microscopic level there. So unfortunately it happens, man, and it can definitely change your life in a drop of a hat.
It completely change your life and the lives of those around you. And I want to say real quick, confrontations are when you go to the eye doctor and they ask you to cover one eye and look straight ahead, and they tell you to say how many fingers you see. That's what confrontations are. I wanted to comment too on the high blood pressure, because I've been seeing this a little bit on TikTok and things, and I'm not a primary care physician, and I'm not giving like official medical advice or anything, but I keep seeing this thing where people are saying that as you get older, your blood pressure is supposed to be higher, and so that there's not a need to be on medication to lower blood pressure and all of this. That used to be the belief. That is not what the science bears out today. Everyone's blood pressure should be about 120 over 80 or lower.
Yeah, I'm almost positive that there's not a single governing medical body that would buy that or endorse that. Yeah, for sure. No,
you're playing with fire if you're going to let your blood pressure just be high because you're concerned about taking medications or something like that. We'd rather you never get to the medications, but if we get there, you don't want to leave your blood pressure high. So.
Right. So at this point, they leave the record store, they borrow the ex-boyfriend's car, and where are they heading when they leave off in a nice drop top candy red Mustang?
I think they're going to visit the singer again.
Oh, that's right. They because was this at the point where she was doing a photo shoot or?
Yeah, I think
that's
so.
right. And then they click up with the singer, and then they have a real good time. And
Wearing those sunglasses.
Yeah.
Very fashionable.
Good
I
sunglasses.
looked those up. Yeah. Yeah, there was a bunch of articles about Lindsay Lohan's sunglasses that she was wearing in there. Those are Dior's.
Oh, okay.
Yeah, Dior. I can't remember the exact the model name or whatever else, but yeah, I looked it up. It was like 5 or 6 articles about it. So.
Yeah, the UV protection in the movie was on point. That's one thing I noticed right away. I was like, we're really representing UV protection well here. That's another thing that's important.
Los
Protect your
Angeles.
eyes with sunglasses. Yeah.
Oh yeah, that's right. Yeah, and not just. I mean, you can get UV protection sunglasses from anywhere over the counter. Well, you can get sunglasses over the counter. Just make sure that the sticker says UVA, UVB protection. On there. That's a huge distinction for those who are sunglasses wearers out there. But yeah, but UV protection is very important. And we can touch on the bumps of the eyelids at in another episode.
Oh yeah, we'll say.
But we'll definitely revisit that at some point. So where are we in the movie, Dr. Wilson, Dr. Reese?
Well, we just left. Yeah, so they went to go back to the singer and everything. I wanted to point out too, when they're in the record store, for some reason we don't know what happened, but there's some kind of romantic flame between Tess, the mother, and Jake.
Did you guys see the original?
It's been a while.
The whole the hilarious thing in Freakier Friday is that the whole time that Lindsay Lohan's boyfriend was with her, he was actually in love with the mom.
Oh,
I haven't seen that movie in so long. Okay,
and so they play on that in Freakier Friday.
Oh wow!
Where the boyfriend's not interested in Lindsay Lohan at all, and the daughter switched places with him, so they don't know that. They think, but he's really in love with the mom. He's in love with Tess.
Gotcha. That kind of makes sense at the end of this movie. Okay, gotcha. Okay.
Yeah.
Yeah, I thought we were just. You know what? I should have done better research. I didn't watch the old movie. I've seen it before, but it's been okay. Yeah, I was just putting together context clues. I guess I didn't have to. All right, cool.
But you're right. There was some weird tension.
Yeah,
it was weird. Yeah, I wasn't comfortable with it. So anyways, couple things happen. One of the things that happens is Harper then has a immigration meeting with Eric, because they're both from different countries, and so they're meeting with the immigration specialist, and Harper's whole plan is to sabotage this for Anna and Eric. That's their plan going in. But then when they start doing the questions for basically they're doing this, if you've ever seen the movie like The Proposal, they're trying to make sure that this isn't just a sham marriage to get a green card or something like that, right? And so they're asking questions to make sure this marriage is real and they really know each other. And Harper realizes that Eric really not only knows her mom, Anna, really well, but knows Harper herself really well, and really, really loves them and really cares about them. And this whole time, Harper's seen him as this bad guy who's coming in and destroying her way of life and all this. And she starts to realize, no, this is a good guy that loves us and makes my mom happy. And so you start to see Harper's heart kind of start to change a little bit and be like, I don't know if we should be breaking them up. So that's kind of an important part that starts to happen here. But important to note that Lily is not there. So Lily is still very against them being together still at this point.
Right.
So yeah. And so then the next morning, Harper, in Anna's body, goes to go surfing because Harper loves to surf, right? And so she's going to go do this as Anna. And she gets out there, and Eric is already out there surfing. And she's like, what are you doing? And he's like, well, I'm doing our lesson so that we can surprise Harper with surfing. Well, so she just kind of realizes even more that this guy really cares about me and my mom. And yeah, just hearts are starting to change. So this is a day before the wedding's supposed to happen, by the way.
Yeah. And from Lily's point of view, she's seeing her dad talked with Harper in Anna's body, and she thinks that Harper's trying to convince Eric to stay in Los Angeles.
Yes.
Yeah.
Yep.
And so she's kind of harboring resentment against it, thinking that, they're working, she doesn't know that this understanding is happening. She just thinks they're trying to be in cahoots.
Right. Yeah. Because Eric, unprovoked, says, I think we should stay in Los Angeles. And that's kind of been the whole argument is, should we go to London? Should we go to Los Angeles? One girl wants to go one place. One girl wants to go another place. We find out the reason Lily really wants to go back to London is her mom has passed away, and she has a lot of emotional attachment there because of her mom. And so that's part of what kind of needs to happen is she needs to heal a little bit from that during this movie also. And that doesn't happen right away, but it starts to happen eventually. So we go through the rest of that day. It's Saturday, the day before the wedding, and we get to the rehearsal dinner. Now we're at the rehearsal dinner. Is there anything we missed in between the rehearsal? I feel like we got to that pretty quickly, but was there anything I missed in between?
No, we hit all the hot points.
Okay. Yeah, so we get to the rehearsal dinner. Harper has really had a change of heart and is kind of like conflicted about, are we really going to try and sabotage this still? Lily still wants to sabotage it in Tess's body. They're at the rehearsal dinner. What do? They invite Jake, the boyfriend who's also in love with Tess, to come to the wedding or to come to the rehearsal dinner. There's this whole big like show or like argument.
Yeah.
What'd you say?
They made a scene.
There you go. I said show. They made a scene in front of Eric, and Eric is like, "Who are you?" And he's like, "Well, I'm Anna's ex-boyfriend." And so Eric's obviously pretty uncomfortable with that. And then Lily comes out in Tess's body and says, "I don't think he's right for you," talking about Eric. It's pretty heartbreaking, honestly. And you can tell that Eric is hurt, and he, right in that moment, says, "You know what? We can't do this wedding. Like, if this is going to hurt Lily in any way, we can't do this." And basically calls off the wedding right there. And it's sad, but and you guys want to add anything there?
Nope.
No. Yeah. So that's right. We're kind of getting to the climax of the movie here. Wedding's called off and everything for a little bit, but then as Tess now realizes what she's done wrong, or I should say Lily in Tess's body realizes what she's done wrong. She sees how upset her dad is. She sees how upset Harper is. She sees how upset Anna is. She realizes, okay, I maybe messed things up here. And she tries to chase after Eric out to his car to get him to change her mind, right? This is Lily, in Tess's body. She's trying to say, like, listen to me, Dad, listen to me. But he doesn't see Lily, he sees Tess, right? And so he's not listening. He's like, look, Tess, like, this is what I have to do for Lily. We can't hurt Lily this, Lily that. And then Tess shows up in Lily's body and basically says, Dad, I want to stay in LA and I want to get this family together. And basically that fixes everything in Eric's mind. But what's happening at this point is Harper, or Anna in Harper's body, is getting all these text messages from her client, the famous singer. And Anna is a professional, right? And she sees that her client, her singer, is in trouble. So she says, I can't worry about what's going on personally. I need to go take care of my client. Mm-hmm. And so she runs to this concert to go and take care of her client to see what's wrong. What's actually going on is her client, the singer, has gotten her old band back together, Anna's old band back together, and is going to do a surprise performance. And it's a pretty cool scene. Harper in Anna's body goes out there, but she doesn't really know how to sing or play the guitar. And Harper just says, go out there, or Anna in Harper's body says, go out there, and is playing the guitar in secret behind the stage. Now, Josh, did that happen in the first movie? Is this a callback to that? Okay, I thought it was. But, okay, so yeah, that's what's happening. But then Anna calls up Harper, or Harper calls up Anna, to come up and sing with her and play the guitar with her. And they do this really cool performance. And while the performance is happening, Eric shows up with Lily and Tess and makes his way to the stage, and they make up and they forgive each other, and they all switch back right in that moment. There's like, everyone realizes, they kind of stop looking inwardly and start looking at everyone around them, and everyone changes back to who they were originally.
And that scene was really trippy. If anyone ever struggled with visual motion sensitivity, they would struggle with that scene where it's like the camera pans up.
Yeah.
Oh, while they're changing?
Yeah.
Yeah.
Well, explain that a little bit for us, Josh. I'm sure that's a term that our audience is not familiar with.
So visual motion hypersensitivity is something where your peripheral vision. Your brain has a hard time processing what's happening in your peripheral vision. So like moving patterns or like, certain flashing, that kind of stuff can be way overstimulating for a patient, especially after like a brain injury. It can really throw them off, throw their whole, brain and balance off. And so some visual triggers like that motion of falling backwards can be really off-putting to some patients.
Oh, wow.
Yeah.
Have you encountered quite a bit of that in your residency?
I actually have encountered a lot more of it than I thought I would.
Okay.
And is it usually from secondary to traumatic brain injury?
Yeah, it's mostly post-concussion kind of patients.
So is it something that's more transient? Like, is it something that just kind of passes through as the patient gets better, or is it something that they deal with chronically?
So hopefully it's something that passes through, but the ones we deal with are usually the chronic ones where the symptoms aren't going away. And we want to try some other intervention like prisms. Sometimes there's an ocular deviate or, like atropia going on where you can put prisms in front to help it. And so that's kind of when we see them.
Gotcha.
It's a chronic.
So do you guys get a lot of referrals into the practice that you work at?
Yeah, it's a lot of neurology referrals and PTs, OTs, OHSU, which is the big hospital in Portland. They send a lot of patients to us.
Gotcha.
Yeah.
Okay. And has go ahead, Jacobi.
No, I was just going to ask. So when you see a patient for the first time there, and they're dealing with this specific condition, how would you set expectations?
It's really hard because a lot of neuro stuff is every patient is so unique that the literature is going in a couple of different ways with it, and so there's no, standard of care is kind of. You got to be really hesitant about prognosis with a lot of these patients because they're all so unique. And so you kind of just say, this is something we can try, these prism lenses or, tints transitions. Speaking of transitions can be very helpful with patients with like hypersensitivity and light sensitivity because, they dim when they go outside. Right. So there's just a couple of like tints, prisms, and even some vision therapy if there's binocular vision things going on can be good, useful things for brain injury patients. But you have to kind of be upfront with it. Like we've seen this work in patients before, but it's up to you to move forward with it because the research is not all the way there yet.
Gotcha. What are you thinking, Jacob? It sounds like you want to ask a question. It looks like you want to ask a question.
No, I was going to ask what you're the owner of is it a private practice where you're at?
It is. It's pretty big. So they got 7 different doctors in 3 different locations around Portland.
Okay.
What have they done how have they garnered these referrals? Like how have they made themselves known? Because I don't think vision therapy is something that all of the medical field is super aware of.
Yeah.
So what have they done to build this?
The doctor who owns the practice, he's like, I don't want to throw out an age, but he's been practicing for a long time.
Okay.
I don't want to guess because I don't know. My guesses might be offensive.
Okay.
But he's been practicing for a long time, and we refer a lot to other practitioners as well, because sometimes it's a vestibular issue, not a visual issue, that kind of stuff. So we refer a lot out, and we make sure that when we refer, we send our notes. And they also lecture a lot. So they give educational opportunities in the community and to other professionals. They're taking me to a lecture they're giving at OHSU in a couple of weeks. So it'll be good.
Okay, cool.
Yeah, because I was just thinking how would you decipher between, motion sickness versus the peripheral issues, because you just alluded to some of it may be vestibular, which is inner ear issue.
Yeah, there's a couple of different things you do. We learned some of them in school where you have them kind of do like a balance test with eyes open, eyes closed to see if that affects it. The optokinetic nystagmus drum is helpful for
Yeah, I hadn't seen one of those since school,
centrally.
man.
Yeah,
Yeah.
centrally and peripherally to see if that causes symptoms to worsen. Like pursuits when
Okay.
someone's doing like EOMs.
Oh yeah.
That's a lot of visual motion as well. So kind of asking about symptoms as you do some of those tests can be helpful for seeing what's next for the patient.
Okay. And we know we're putting you on the spot because we know
Oh yeah,
you're only 2-3 months into residency. But
Hey man, he's the professional. He's the professional, and he's Dr. Reese is definitely carrying himself as such
Yes,
on
he
tonight's episode. So we appreciate you, my friend. But did we close out the movie? I feel like we did.
I think so.
Kinda. They all went back together and then they got married the next
And
day.
they're happy.
Okay,
Yeah,
everyone's happy, getting along.
Oh, there was also a pickleball scene. That's the reason I wanted to take my parents to it. Is because they're into pickleball.
There is a pickleball scene.
That's all the rage
Pretty
right now, man.
Yeah,
Do your parents play quite a bit?
They do. They are very into it.
Nice.
Ah.
Yeah.
And remind me, Josh, your parents live in the Pacific Northwest?
I'm actually in their home right now. I moved back in.
Oh, they let you come home, man. That's sweet.
Oh, for real? Oh, okay.
Yeah,
okay.
just for 1 year.
Okay. I was just trying to think of where pickleball might be most popular, but I guess it's all over the country right now.
Yeah, I think it actually started in Washington, so pretty close to home.
Okay.
Washington State.
That's crazy how things can just take off all of a sudden. Yeah, and I guess the best thing about pickleball, even I hadn't played it yet, but it seems like it's pretty suitable for all ages, right? So as long as the weather allows you to be outside to do it, I guess you can do it indoors as well. But yeah, it seems like a pretty fun game though. So how often do your folks play it?
Oh, they play it daily.
Oh, really?
My dad tries to play every day.
That's like their exercise then, huh?
Yeah.
Okay.
So they all locked in. They got gear, paddles, headbands.
We just for his birthday we got him a new paddle.
Okay.
Nice.
It's been good.
Hey, are they wearing eye protection out there?
No. Ooh, but
I don't know if that ball would do too much damage.
Come on, Jacob. We promote eye care here.
I have seen
I know,
a pickleball eye injury before.
Oh, okay. All right.
Yeah.
I guess anything could hurt the eye if it hit just right. Yeah. Eye protection, everybody. Don't listen to me.
Yeah, don't listen to Jacob. What is he? He's just a residency trained optometrist. What is Jacob? He's just.
Well, you have to pull on LeBron face mask when you're playing.
There we go. Get the sports vision people involved for the special tints and.
So I know it's kind of early, Josh, into your residency, but as you get through your program, what would you be looking to do post residency? What would optometry look like to you?
I have thought that a lot lately. I don't know. I think ideally I'd want to own a private practice that does something similar to what I'm learning in the residency.
Okay.
I like the idea of practice ownership and being able to, I just don't want to get trapped in a situation where I feel like I'm not providing the patient with the care that they should be because I have to, follow
the bureaucracy.
The bureaucracy of something. So I like private practice in that way, but I don't have a landing spot, or if I would acquire an older doctor's practice, or if I'd try to start my own, that's kind of up in the air.
Let me ask you, are you getting any of that type of education at your residency? Are you getting to see how the practice runs, billing, like all of that? Are you getting to see some of that?
Question.
Yeah, there's been a lot because the practice is kind of so big. It's hard to get some standardized education on that, like some set time for it. But I've been getting a lot of exposure to it.
Okay.
If that makes sense.
Is the owner your residency director? Oh, sorry.
Yes, he's one of the residency directors.
Gotcha.
Okay.
Mm-hmm.
Are you the only resident there?
No, there's two of us.
Okay, good.
And good. Mm-hmm. Got a co-resident.
Yeah, when I did my residency, I was the only one there. I was, if I could go back, I would really wish I would have at least one other person there.
Yeah.
It's kind of lonely. Did you do your residency by yourself, Jacob?
Yeah, I did. And, for me, I think that's what I needed. I think I needed some extra TLC. from my preceptors. I had like 5 OD preceptors and preceptor is just the doctor that kind of oversees you, and 1 ophthalmologist. So I saw it as I got all the education all the time just for me, but also that means I got all the criticism all the time just for me. So sometimes like I do wish I had got to share that with someone, but I think it was the right experience for me.
Gotcha.
That's good.
Well,
but that's
perfect,
something you
man.
can look at. Oh, I was going to say real quick, when you guys are 4th years, if you're listening, when you're applying for residency, that's something you can look at on the website, on the ASCO website. How many residents are they taking? And if you think you want to co-resident or don't, that's something you can already kind of know before going in.
Mm-hmm.
Yeah, and I'm not exactly sure when we release this episode, maybe within the next couple of weeks, but I know that the residency application will be opening up soon in October for those who's interested, man. So we have a couple of docs, more recent graduates here that you guys can ask questions for. Dr. Jacob and Dr. Josh are around, very accessible. If you have any questions about residency or their specialty in residency, then feel free to ask them. But you guys, this was a great episode. Josh, I don't think I would have seen this movie without your recommendation. If I'm being totally honest.
Not in theaters.
Well, yeah, maybe streaming. Oh, and we almost got out before we did grade. So, on a scale from 1 to 10. I'll give this a solid 7.5. It was good. It was wholesome. It was extremely funny throughout. And I know we didn't touch on all the funny parts here, but this was extremely funny. And it's good. I love what they do, like sequels, and it's a lot of the original cast there. So, and they knocked this one out the park.
Definitely. I have to give it. You know what? I walked out of this movie inspired, wanting to be a better person and love my family more. So I have to give it an 8.5.
Okay, nice.
That good.
Okay.
I thought the message on families and not every family's a little different. It's it doesn't matter what your family looks like or who they are. There's ways to come together and love each other. So
okay,
wow,
that's my deep cut there from
I didn't think you guys would like it more than me. I would probably say 7 out of 7 eyes or 7 out of 10 eyes.
Okay.
Hanging out with Jacob, Josh, man, we watch a lot of horror movies, man.
Oh yeah. Jamie Lee Curtis.
That's the thing too, is I actually left with a positive feeling compared to how we usually do. That might have something to do with it. But.
Yeah.
Do you remember The Barbarian? When you watched that?
I watched that with you?
Yeah, you watched that with me at the New Orleans.
Oh, I'm sorry I made you watch that. I mean, that's a great movie, but have you seen that, Jacobi?
No.
Very horror movie.
Yeah. They just made the guy who made Weapons made Barbarian.
Oh, okay.
Yeah, so that one's worth watching. Yeah, that's a pretty good one. But Josh, sorry for that New Orleans guy. Yeah. I wasn't even thinking. I probably just had the remote and just put on what I wanted to put on and didn't think about it.
So I know there's
good exposure.
There's a couple of other movies coming out in the near future. Well, not the near future, but I think they'll be out by the time you're finishing up your residency, Dr. Reese. We'd love to have you back on at that time, and then discuss how your residency went, and then your plans at that time, as the residency wind down. And of course, we'll break down another movie and everything. And if you want to come back, we'd love to have you back, my friend.
Oh, this was a great time. I'm just sad that Dr. Kwan stole K-pop Demon Hunters from me.
Hey, they're making a sequel. They said they're going to do a couple of sequels, man. Maybe you can hop on the sequel.
There we go.
We can do a sing-along episode, Josh. We'll have you on.
There we go. We'll do it for the sing-along.
All right, you guys. That'll do us for another episode of the Realize Podcast. Join us pretty soon. Any comments, please follow us on Instagram, and we'll do it again soon. Later.
All right. Bye.
Thank you for joining us for another episode of the Realize Podcast. Be sure to give us a follow on Instagram and TikTok. And remember, don't miss the sequel. Get your eyes checked.
See you next week.